So the project that I have been working on and I presented at Informs this time is about patient access to an endocrinology clinic. So we're analyzing some capacity issues and also how they are getting into the program, making sure they're following through the entire program, making space for them to actually adhere to the program.
We're studying how to improve the flow of patients through a cancer center, specifically looking at the outpatient chemotherapy setting, and we're specifically focusing on simulating the phlebotomy area there to try and improve the satisfaction of patients and phlebotomists alike.
In this particular conference, we were talking about the phlebotomy area and how it's very important for the whole process in the cancer center, and how we approach the problems happening here throughout discrete event simulation.
Essentially what this project entails is ensuring that when you or a loved one goes for surgery, you want to be sure that your surgeon has the right instruments properly cleaned, sterilized, and available at the right time for your proper care. We realized the fact that certain instruments actually were harder to clean than others based on their design features, and also how instruments were grouped together and delivered to the rooms also affected their likelihood of being taken to the operating rooms clean, sterilized, and in working condition. And so using our approach, we created a method to evaluate instruments based on their cleanability, and also developed a tool that allowed surgeons and administrators at the hospital to configure instrument sets in ways such that they could ensure improved financial stewardship and ultimately improve patient safety overall.
So there's critically ill patients that go to level 2 pediatric intensive care units, and these units are smaller. They don't have specialized equipment that might be able to take care of the patient better, or a specialized physician. So what they do when these critically ill patients come is if they don't have the requisite resources to treat them, they'll transfer them to a level 1 pediatric intensive care unit like the University of Michigan hospital system, which is big, has a lot of physicians' equipment. So what are the determinants and what are the outcomes of this transfer decision? So what causes patients to be transferred, and how does that affect the transfer or not? And in so doing, so we did that sort of using statistical techniques, and then really what we wanted to develop is using that analysis, develop a framework that could potentially help physicians make that decision, when you should transfer, if you should transfer, and when you should transfer.
At Informs this week, there's a lot of great talks around, and they're highly variable in terms of topics. You can go into a manufacturing kind of talk, and also healthcare related, as all of our CHEP students have given talks, and there are a lot of ideas and disseminations of information that we can learn from each other. I think that's a great experience at Informs here.
What I really like about these conferences is that I think they're very inspirational because we get to see how we can apply different things that we learn in classes or in our projects, and how other people are using them to solve very interesting problems.